Magandang gabi po muli sa ating lahat. Ipagpapatuloy natin ang ating pag-aaral, pulse diagnosis. Topic po natin ay steering pulse, moving, spinning bean, bouncing, dong mai. Steering pulse. This pulse is also called a moving or shaking pulse. The steering pulse will be seen when a person is in shock or acute pain. It is as if the pulse does not travel in a wave but remains in the individual position and vibrates. So yung mga mayroong pong shock experience, yung mga tulalang pasyente, kasama po natin ang kanilang pulse ay steering. The pulse is described as being like a bean that spins around on its own axle. The pulse is fast, smooth, and strong. Pain results in the pulse contracting and becoming wiry. Shock causes chi to become chaotic. Chi and blood separate from each other and chi raises a head without blood being able to follow. So ganun po yung nangyayari pag may steering pulse, no? Nagiging disorder yung energy natin, kaya pati yung blood and chi, naghihiwalay sila. So sabi dito, mas nauuna yung chi dun sa blood, parang humihiwalay po siya. Kaya steering pulse ang mararamdaman. So pattern of imbalance, shock, and acute pain. So yung pulse description, the moving pulse is short, slippery, and rapid. And it gives impression of shaking or vibrating. So alam na po natin kung paano nating pakiramdaman yung short pulse, ano, na pag nilagay nyo yung inyong finger sa pulsuhan, pag inikot ninyo, hindi po nyo mararamdaman sa lahat ng parte, kundi dun lang sa gitna lang, instead of pulsating. So, yun po, nagbabibrate po siya or nag-shake. Hindi siya pumipitik. It is shaped like a bean without a head or tail. The moving pulse is felt more frequently on the front and middle position. So description po, the pulse is rapid and slippery. At the middle portion, the pulsation is forceful. So pag sa gitna po, pag patong nyo ng kamay nyo, mararamdaman po nyo parang tinutulak. So like a bean bouncing in the vessels with a well-defined peak but without head or tail. So yung key points po nito, shape is short and round. So pag pitik, mararamdaman nyo siyang tinataas yung kamay nyo, ano. Slippery and rapid, malakas po siya at sa in the middle position. So other translation is steered, spinning bean, bouncing. Ayan po yung pulse image natin. So malakas po siya dun sa ibabaw, natutulak yung ating halos yung fingers. So distal, middle, proximal, short po, yun i-explain ko na po kanina paano natin maramdaman yung short pulse. Yan. Parang ganyan po yung shape niya, oh. Mas sa ibabaw, pag pitik, yun, mararamdaman po ninyo yung pitik niya. Yung pagbaba, parang hindi masyado. So yung clinical significance po nito, the moving pulse generally reflects severe emotional problems, particularly shock, fright, or severe anxiety. Yung sobra pong maraming iniisip, maraming problema sa buhay. In cases of shock, the pulse can remain moving for years afterwards. The moving pulse may also indicate severe deficiency of chi and blood. So, kakulangan po ng dugo at saka ng chi. Often manifesting with cramps in the legs. So, pag may moving pulse po yun, namamanhid po yung mga cramps sa ating mga paa. The moving pulse with strength may also indicate chi stagnation. So, kung malakas po yung pagpitik, mas chi stagnation siya. So, indication po nun, pag sa faint and fright, the moving pulse is a sign of struggle between yin and yang. Yin and yang po ng katawan natin yung naglalaban. Pathogenesis, chi and blood stagnation causes pain, yin and yang fight and cause a disharmony of the ascending and descending of the chi and blood. The pulse follow this violent up and down movement. So mismo kasi nga na ano po siya, disordered. Kaya ganun po naglalaban yung yin and yang ng katawan natin. So emotional shock causes chi and blood disturbance and confusion. This leads to the pushing outward of the chi and blood leading to the moving pulse. Remarks po, the moving pulse can be seen in pregnant women in their first trimester. So, consider daw kung normal yan sa mga buntis, yung moving pulse. So, summary of clinical significance, shock, severe deficiency of chi and blood, chi stagnation. Combination, moving rapid indicates heat occurring against a background of severe emotional problems. Nagiging rapid po, ibig sabihin heat yung na ibibigay sa ating mga organs ng sobrang emotional problem. Moving slippery indicates severe deficiency of chi and phlegm. Pag moving full po naman indicates chronic pain. Moving empty, yung halos wala kang maramdaman, indicates severe depletion of blood. Kasi andun yung chi and blood, so kung wala po nito, wala kang halos mararamdaman. Moving weak, so indicates shock. Spinning bean pulse. So ito naman pong spinning bean pulse, the pulse feels as it were spinning. It is short and moving and feels like the coexid semen coisis lacrima jovi. It feels also like rolling fur. Imagine po ninyo yung perlas na bilog na nagro-roll. So this pulse indicates exhaustion of the internal organs. Sobra pong mahina na yung ating mga internal organ pag spinning bean pulse na po. So differentiation of similar pulses. Short. Yung the moving pulse is short by definition. But in addition, it is rapid. Shaped like a bean, somewhat slippery and give the impression of shaking rather than pulsating. So, yun po yung short ano. So, description po nito, the pulse cannot be felt in all three positions. It is absent in the distal and proximal position. Yung po yung sinasabi ko na pag idinikit mo yung iyong finger sa pulsuhan, pag ginalaw mo to, hindi mo mararamdaman sa mga gilid ng iyong fingers kahit ipaikutin mo. Yun po yun. So, yun yung short. So, indication po nito, pag ang chi ay may disease. So, short and forceful, ito ay may chi stagnation. Short and forceless, chi deficiency. So, lagi po nating tandaan, pag may stagnation, forceful, pag forceless, deficient. In biomedicine, aortic stenosis or rheumatic heart disease. So, pathogenesis po nito, chi stagnation fails to move the blood and so the vessel is not stretched. The pulse is short. So, ganun po yung gagawin kasi nga nagbabara siya, hindi makadaloy ng maayos yung dugo sa ating veins. So, pag chi deficiency naman, chi drives the pulse when chi is too weak to move blood circulation will slow and the blood in the vessels will stagnate. The pulse will feel short and forceless. In biomedicine, aortic stenosis causes the blood vessels to thin and weaken, in which case blood will be hindered from flowing into the vessels. Yan, hindi po makaayos na ng daloy. So remarks po, short pulse can be seen in cases where there is profuse sweating but little intake of fluid. Ayan, yung pasyente ko po ng isang araw, hindi umiinom ng tubig, short pulse po siya. So, slippery, balikan po natin. The moving pulse is slippery by definition. But in addition, it is short. Rapid, shaped like a bean, somewhat slippery, and gives the impression of shaking rather than pulsating. So, nagsishake siya, nararamdaman natin, instead na pumipitik. So, hindi pitik pataas, kundi parang yun, nararamdaman natin sa fingers natin na nagsishake. So, description po nito, the pulse feels quick, through it is not rapid, is slippery and smooth. It is rounded inside the vessel. Traditional description, like a fur rolling on the plate. So, ang key points, smooth and slippery. So, other translation po ay rolling. Ayan po yung pulse image. Imagine po ninyo yung parang may perlas na, kaya po yan, hindi yung pitik ang mararamdaman mo yung parang pag-roll. Rounded shape ang pulse quality. Sa indication po, pag may food stagnation, phlegm or dampness, then excess heat. Pathogenesis, when excessive pathogens enter the body, the antipathogenic chi rises against the pathogen. So, ibig sabihin po nun, pagpapasok yung mga sanhi ng sakit, lumalaban yung ating mga sundalo or yung ating energy, yung ating antipathogen. The chi and the blood are mobilized and become entangled with the pathogenic factors in the blood vessel. The pulse become plump and slippery, or dampness or phlegm causes an increase in blood viscosity and decrease in pulse wave flexibility. Hence, the smooth pulse without corner. So in biomedicine po, fine elasticity of blood vessel, smoothness of internal wall, normal or lower peripheral resistance. So ang remarks po nito, the slippery pulse is considered normal for pregnant women, in whom it indicates sufficient and harmonious chi and blood. So yun po yung sinasabi, pag buntis, normal to. Nagsasabi to na sapat yung kanyang dugo at saka chi, in the absence of any pathogenic changes. Kung wala siyang nararamdaman na, halimbawa, hindi siya nalamig, hindi pumapasok yung lamig sa kanya, walang sobrang init sa katawan niya, so normal po yun. The slippery pulse can be found in the normal person. So kung healthy yung tao at slippery yung kanyang pulse, normal daw po yun. Yan. Tingnan po natin yung illustration ng moving pulse. Sa Chun Guan Chi. Yan, makikita natin yung superficial, middle, and deep. The pulse will feel rapid, tight, slippery, and short. With the strong beats is called a moving pulse. Paano? So rapid siya, tight, at saka slippery. Alam na natin kung paano hanapin yung short na-i-explain na po natin. It is like a bean and feels strong under the fingertips. So pag pinatong mo yung kamay mo, yung fingers mo, mararamdaman mo dahil strong siya. Yun po yung moving. With well-defined peaks but without head or tail. Ang mararamdaman mo lang yung pagbunggo ng pitik dun sa kamay mo. Pero yung pagbaba, hindi mo na po mararamdaman without head or tail. Pagtaas-taas lang. So traditionally, the moving pulse is said to appear only at the guan position. Sabi sa guan position lang na ito nararamdaman. However, it can actually be felt in any of the three positions. So the moving pulse is usually caused by yin and yang, chi fighting with each other. Yung mismo pong yin and yang ng katawan natin ang naglalaban. When yin and yang chi fight with each other, the winner has come, my chi. But the loser is firm, hard, and strong. Yun po yung description. So, pulse comparison. A moving pulse is rapid pulse, which can only felt in the guan position. So, mas rapid daw po yung moving pulse at sa guan position lang nararamdaman. So, ano ba yung guan position natin? Andun yung organ ng spleen and stomach. The moving pulse can be felt when pain is caused by excessive cold. Winning over yang. Yon. So, kung sobra ang pumasok na lamig sa katawan ninyo, syempre yung yin ang nag-win. Kaya ang bumaba yung yang. When fright or palpitation are caused by chi confusion, when spontaneous perspiration is caused by yang not winning over yin, when fever is caused by yin not winning over yang, when diarrhea is caused by disharmony between the spleen and stomach. So na-imagine po natin na siyempre pag nanalo yung yin, siya ang tataas, bababa yung yang. Yun po yun. When dysentery is caused by qi and blood disturbing each other. So ang gagawin po niya yon, yung transportation and transformation function of the sangfu are impeded. When jingmai contraction are caused by yin cold, pervert qi enduring the channel qi. Yun. Pag yung yin po ay napasok na, so mas tataas siya yung yin. Ngayon, yung mga function ng organ po natin, hindi na niya magagawa kasi hininder na po ng cold. So when failure of jing in men, sa lalaki daw po, or uterine bleeding in women is caused by yin deficiencies. So bumababa yung yin at yung yang ang tumataas yung excess. So nawawala po yung balance ano. So ito sa huli na sinabi, ang tataas ay ang yang at bababa ang yin. Pag mayroong uterine bleeding. Kasi nakita naman natin uterine bleeding, lumalabas yung dugo, ibig sabihin maraming heat kaya lumalabas yung dugo dahil nakita natin yung excess yang. In general, the moving pulse only appears with the symptoms when the yin and yang have been fighting each other. So when the yang wins, so ang nanalo po ay yang, ibig sabihin siya ang tataas. So the yin is deficient. Bababa naman si yin, nawawala siya sa normal level. So the yin chi attacks. The pulse become firm and tight and the moving pulse appears. So ganun po yung nangyari. So magpipilit pa rin si chi na lumaban kahit bumaba siya pero nagpipilit pa rin siya. Kaya mararamdaman na natin, nagkakaroon ng firm and tight pulse. Firm and tight moving pulse. So when yin wins, kung si yin naman daw po ang tumaas, si yang nagiging empty, nawawala sa normal level, bababa siya. So the yang chi attack, pipilit pa rin po siyang tumaas kasi gusto pa rin niyang habulin si yin. So ang nagiging nangyari po, ang pulse become tight and firm and moving pulse appear. Yan po. So moving, yung quality po, tingnan natin yung explanation. Pag rapidity, explanation nito rapid. Length, short. Yung strength po nito, malakas po ang moving ano. Yung quality nito, mararamdaman natin ay slippery and wiry. So meaning po, yin and yang fighting with each other. Explanation, either there is confusion and scarring of qi caused by fright. Pag natakot po tayo, ang yin ang nawawala, yin loses. Or pain caused by qi being black by blood. Ang nawawalan, ang bumababa naman po ay ang yang, kaya yang loses. Whenever yin and yang fight with each other, the winner tries to calm the my qi, but the loser make it strong. Hence, the moving pulse appear. So, yun po yung explanation. So, yung ang nagiging malakas ay makes it strong. Nagpipilit kasi siyang tumaas pa rin kahit loser na siya. Pipilit siyang humabol. Hindi niya matanggap na loser siya. Kaya po yun, moving pulse po ang nararamdaman. Pipilitin niyang mag-balance. Ganun po yung katawan natin eh. Pinipilit mag-balance kahit hindi na kaya. So, thank you po for your attention. Ganda po ng topic natin, paglalaban ng yin and yang sa ating katawan.